Good evening, y'all. I hope y'all are well. I realize a lot of y'all have come from my CIC video, so we're gonna do some questions. In full transparency, I did do this test last week. I just want to test my knowledge, but I'm gonna do it with y'all so y'all can kind of see how I walk through the questions in my process. Question number 1, it says, in an outbreak of probable foodborne illness, patients develop symptoms 2 to 4 hours after eating a turkey salad. The most likely causative organism is. So I know that Staph aureus, from my studying, has one of the most rapid onset of symptoms. So that would be my answer. But what I would kind of do is I would kind of go through, I wouldn't say Vibrio. What I would kind of cross out would be Vibrio first, okay? You have C. perfringens, okay, and then you have Salmonella. I know the answer is Staph aureus. Staph really kind of can come from really like ready to eat foods. So the answer is going to be Staph, which is B. Moving on to question 2. The answer key is down at the bottom left, so just be careful, like when you're testing yourself, that you don't accidentally show yourself the answers. So for Salmonella, you can see symptoms will typically appear within 6 hours to 6 days after exposure. Okay. The question asked about 2 to 4 hours, so this is a little longer. I think Salmonella would be the next. So like if they ask like what would be next, I think this would be the next one. For Vibrio, parahemolyticus, I think is how you say it, it's 12 to 24 hours, right, after consuming contaminated seafood. So typically we see Vibrio with raw oysters. That's kind of what you see. You also can see Vibrio in like when people swim in bacteria-filled waters. So it could be like after, storms. I think actually right now in Florida, they're telling people to avoid certain beaches because of Vibrio. So yeah, but it's a bacteria. And then you have Clostridium perfringens, or C. perfringens. This is 6 to 24 hours after, so it's pretty fast as well. I think there is a CDC guide that has all the foodborne illnesses and then like the time frame. So if I find it, I'll link it in the description. With Staph aureus, which is the answer, is within hours. It's pretty fast. It actually happened within 30 minutes. So it's really rapid. And like I said, a lot of this comes from ready to eat food. So it's gonna be your turkey salad. It's gonna be things that you can just, eat, like ham and things like that. Question number 2. The presence of which of the following antibodies to hepatitis A virus confirms the diagnosis of acute Hep A? Okay, so when I was learning this, somebody taught me IgG, IgM, right? IgG, it stands for I got it gone, meaning it's more of a chronic thing, okay? IgM, I got it man, meaning I got this right now. I'm gonna take care of this right now, which is more so acute. So when I was doing this question, that's what I said. I said, okay, I know IgG means I got it gone, so it's gone, okay? And I got it, IgM is I got it man, so I got it right now. I'm gonna handle this. I'm gonna take care of this problem right now. And so it's gonna be IgM, I got it man, so that's B. Number three, moving right along. Investigating, an epidemic, cases should be categorized according to. So, in fair warning, I got this wrong. There's absolutely no reason I should have got this wrong, but I got this wrong because I was thinking of something else. I was thinking of, I was reading too fast. I was thinking of what's called the epidemiological triangle. And if you know what the epidemiological triangle is, then you know what answer I picked. But that's not what the question asked. They said when you're investigating an epidemic, okay, we know what an epidemic, it's in a specific area, right? Cases should be categorized according to, come on now, the answer is right there in our face. It's gonna be time, place, and person. It's gonna be A. But because of the epidemiological triangle, let's look that up. This is what I was thinking of. I wasn't reading the question. So I was like, oh, the answer is agent, host, and environment. No, that's not what they're asking. Okay, they're asking about an epidemic, not an epidemiological triangle or triad. So if you don't know what that is, this is what it is, okay? The agent is the microorganism that causes the disease. So this can be the bacteria, the fungi, parasite, virus. The host, this is where it lives, right? So the agent, okay, the type of microorganism infects the host, which then carries the disease and can have symptoms, okay? This is related to like age or genetics. And then the environment. External factors that affect the spread of disease but are not directly a part of an agent or the host are collectively known as the environment. So it's the climate, the water quality, living conditions can all affect that. I said, be careful when you scroll because the answers are going to be down here on the left, so just kind of be careful. Number 4, the lengths of stay for patients with healthcare associated infections are 12, 12, 12, 13, 15, 15, 16, 20, 30 days. What is the median length of stay? First off, you need to figure out what they're asking for, okay?
Okay, so let's just start with what the mean is. So if you don't know mean, median, mode, you need to look those definitions up. The mean would be the average of the norm.
The median, that's what's in the middle. Once we put it all in line again, chronologically, that's what's in the middle. So we're looking for the middle, right? And then we know mean, median, mode. Mode is the one that occurs the most, okay? So in this example, they gave us these numbers, 12, 12. And the good thing about it, they already put it in order. So we ain't even got to do that. But if it's not in order, you need to put them in order chronologically. So it's 3 12s, a 13, 15, 2 15s actually, 16, 20, and a 30, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 2, 4, 6, 8, yeah. Okay, so now for the median, we said it's the middle. So we're going to go ahead and start crossing out, right? Cross, 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 cross. Looks like we're left with number 15. That's going to be B. Number 5. The risk of healthcare-associated urinary tract infection, or UTI, in spinal cord injury patients is best reduced by. So when you see questions like best and the most, typically that means there could be 1 or 2 answers, but you want to go with it could be a correct answer, basically. There could be several correct answers. But what's the best? The best, okay. So we have prophylactic antibiotics, bladder installation of antiseptic, intermittent catheterization, placement of all patients with urinary catheters in the same area. So looking at D, if I put everybody with a urinary catheter in the same area, what is that doing? Is that going to decrease the risk of a healthcare associated infection? Probably not, okay. Now, if this question talked about something such as COVID, if I had all these COVID cases and I want to move these residents, that would probably be a better answer. But this is talking about spinal cord injuries and UTIs, okay? Putting everybody with a catheter in the same area is not going to help best reduce HAIs, or healthcare associated infections, okay? I'm going to cross out D. Prophylactic antibiotics. So if you know anything about antibiotic stewardship, we don't want to just give antibiotics just to be giving them. You know, we want to have certain parameters and things like that. So we don't want to just give anybody antibiotics. So giving somebody prophylactic antibiotics, which means you give it ahead of time before you get cultures and things like that, that's not going to help reduce the risk of UTIs. Honestly, it might, make them more resistant to antibiotics, okay? Because we're just giving them without knowing what's going on. And then B, so we're going to cross out A and D are crossed out. Bladder installation of antiseptic, that's not going to help anything. So what it's going to be, the answer is going to be C, which is intermittent catheterization. So basically, you don't want to have this catheter in forever. So if we intermittent, do it here and there, when they need to void, all that kind of stuff. When we do it intermittently, we're helping to reduce the risk of HAIs, as long as the staff members are doing it, appropriately, hand hygiene, all of that kind of stuff. So the answer is going to be C. That's going to help reduce the risk of HAIs related to urinary tract infections, because we are not leaving that catheter in forever. So, the longer a catheter stays in, the longer it has a risk of infection. So answer is going to be C for number 5. Moving along to number 6. Which of the following precautions must be taken when using a respiratory ventilator? So that means it has to be done. No ifs, ands, or buts about it. So A is use gloves when assembling equipment. Use only disposable equipment. Use only sterile fluids and reservoirs, or discard unused portions of medication daily. So think about it. We're talking respiratory ventilators, right? This is going to somebody's lungs, okay? We want to have the most safest thing that we're doing, and that's honestly going to be to use only sterile fluid in the reservoirs. Discarding unused portions of medication, is that going to help? Does that have to be taken? Like that, is that a must? Using gloves while assembling equipment. You're assembling the equipment. Is that a must? You're not. It's not like you're, suctioning the patient, right? B, use only disposable equipment. We know that's not necessarily feasible. Like, ventilators are meant to be used, so you just have to be mindful of that. So the answer is going to be C. Use only sterile fluids. Number 7, student demonstrates appropriate trach suctioning. That's funny, we're talking about trach. Suctioning technique to an instructor. This is an example of, okay, so let's read this question again. Student demonstrates appropriate tracheostomy suctioning technique. So they're showing how to suction a trach. This is an example of what? Cognitive learning, okay, psychomotor, affective, or theoretical. So they're demonstrating, they're actually doing it. So somebody is watching them do this demonstration of how to suction a trach. That's going to have something to do with the mind, and it's actually an active thing. So it's going to be psychomotor because they have to actually demonstrate it. So it's going to be B. And number 8, a long-term care facility has 180 residents, 50 of whom have indwelling urinary catheters. An IP notes 15 catheterized residents have developed UTIs during 1 month. What is the attack rate? So, the attack rate. Okay. About the attack rate. All right. So, looking at the question, it's saying that we have 180 residents, 50 have catheters, okay? I note that 15 patients that have catheters have developed a UTI during 1 month. Okay, so some of these numbers are not going to be relevant. So like this 1 month, that's not relevant. What we're going to do is we need to figure out how many patients. So this 180, this is what they try to get you to throw you off. They want to know, we're talking about catheterized patients that have UTIs. This 180 is just telling us that's how many are in the facility. We don't care about that. We want to know how many patients of the ones that are catheterized have UTIs. So that means if they're telling us there's 180 patients in the facility, but 50 of them have catheters, that needs to be our denominator. Because like I said, it's the amount of people that have catheters, UTIs over the people that have catheters. So now they're saying 15 of the catheterized patients have developed UTIs. So what's our numerator going to be? It has to be 15. So people are going to get thrown off because of this 180 and this 1 month. They're going to be doing all types of calculations. This is what you're going to calculate. You're going to come out with, what's it? It's 15 over 50, which equals 0.3%, times about 100 to get the percentage, which is 30%, which is D. So I already told y'all the answers, but we just gonna go through them for the sake of this. 1 should be B, okay. 2 should be B. 3 should be A. 4 should be B. 5 should be C. 6 should be C. 7 should be B. And then 8 should be D. Yeah. So when I did this, I got 7 out of 8 right. The only one I got wrong was this one. And like I said, it was just because of that stupid mistake. All right, thank y'all for hanging with me, doing some questions. If you did not get at least an 8 out of 10, or not an 8 out of 10, 6 out of 8, 7 out of 8 really, you're not ready to take tests. And that's okay. You need to keep studying, get back in the book, read the APIC text, and get it together. But you're not ready, and that's okay. But get it together. Let me know if y'all like this video. I might do some more. There's other questions I've seen. So let me know if y'all like this type of video. I can do some more questions and we can kind of go through it. I always will refer you to the APIC text, CDC, all the things. Don't just take my word for it, look it up. And this is just kind of how I walk through the process of these questions. I don't mean that's the absolute best way to do it or that's the only way. It's just my thought process. So like the question talking about what type of like tech or what type of learning or whatever that is, you should look up the other ones. So look up what cognitive learning is. You can even look up the answer, what psychomotor is, what affective, what theoretical learning. Like look those up so you have an understanding. Also know your calculations. So know how to calculate an attack rate. All of those things. They're all important. Until next time, y'all, I'm gonna leave it here. As always, stay grateful, stay faithful, stay consistent. Peace.